NPO Beyond Zero has introduced BeyondPrep, a virtual telemedicine service that provides free PrEP delivery and support. This initiative is accessible in several provinces, including the Free State, Eastern Cape, Limpopo, Mpumalanga, Northwest, Western Cape, and KwaZulu-Natal. The service ensures discreet delivery of PrEP medication, accompanied by essential health supplies such as condoms, lubricants, and HIV self-testing kits. Additionally, users benefit from the 24/7 telephonic support, where a dedicated team is available to assist with guidance, address any concerns, and promote adherence to the PrEP regimen. We now talk to Edward Sibanda from the Key Populations Technical Lead for more on this discussion. Edward, thank you so much for your time this evening here in SABC News. Now, of course, this is a very important initiative which you have embarked on. Perhaps just tell us, when it comes to these services in which you are providing, how did it come about?
Okay, thank you very much and good evening to your viewers. As a point of departure, Beyond Zero, an organization that is committed to health transformation, is one of the 4 principal recipients in the country under the Global Fund program, which looks at 3 epidemics, namely HIV, malaria, and TB. So Beyond Zero was tasked to pilot in what we call innovation projects to ensure that we come up with lessons that can be drawn and upscaled. So in this instance, we're tasked to look at other measures that could make health services accessible to key populations. If I'm talking about key populations, I'm talking about population groups that are usually underserved and they encounter stigma and discrimination within facilities, which makes them more susceptible to HIV than the general population. So in this instance, we were asked to pilot a project which is an online clinic that would enable clients to register and then receive medication via a courier service. So this is a discreet service in terms of the parcel that is sent. It's a normal parcel that doesn't show what's inside. So in this instance, a client can just register on the portal. Once they register on the portal, they are captured in the system. Once they are captured in a secure system, their consent as well as their consent form is shared with a service provider, who in this instance is a pharmaceutical organization, who will then capture them and then link them to a particular nurse and counselor. And then once they receive a welcome call, they will then be allocated their medicine. And then which is a 3-month supply of PrEP, as well as HIV self-screening kits, as well as condoms and lubricants, including information in terms of flyers. So when they receive their 3 months medication, they will then be called, let's say 3 weeks before the lapse of that medication, so that they can go and test again. And when they retest, and then if they are negative, then they will be continued on medication. If for some reason they seroconvert or they test positive, we then refer them for confirmatory testing, and then if they are positive, then they are referred for treatment. But if they are negative, then they will receive another script and meds. That's the process.
And Edward, I mean, who will be able to make use of this initiative? Is it available to anyone who goes onto your portal to register?
So as I noted earlier on, this is a pilot project. So in essence, we're trying to gather information before we upscale it. So currently, it is limited to the districts that we are working in. So basically, we are in 7 provinces. So for men who have sex with men program, we've got 12 districts. For the transgender program, we have got 6 districts within 5 provinces. So yes, so those are the clients who are registered through our partner networks or sub-recipients on the ground. They are the ones that look at the convenience of offering this particular service to their clients, and then that's how they are enrolled onto our portals.
I know it's a pilot project for now, but you know, why the target to only these 7 provinces?
Okay, so currently, as part of donor coordination, we are allocated certain districts and provinces where we operate, and then other funders, they operate in other districts. So in this instance, particularly focusing on the Global Fund district for Beyond Zero, for the prevention program for men who have sex with men and transgender people, who are key populations.
Yeah, and maybe, let's tackle some of the issues that people face when they go to, our healthcare facilities and when they try to get a hold of their medication. Sometimes it comes with discrimination, sometimes it comes with targeting, and also then it also hinders their progress in terms of receiving their necessary, medication. How has this been received by those who have been using it so far?
Yes, as you have alluded, as key populations that I have noted in this instance, men who have sex with men and transgender people, they are disproportionately affected by HIV compared to the general population due to stigma and discrimination. So in essence, they are hesitant to go to facilities that are not sensitized because they fear to be outed or to be discriminated against. So in that instance, they'll be susceptible to HIV. But this particular program ensures confidentiality in terms of clients. We keep it discreet. So in that instance, one can receive medication in the comfort of their households without necessarily going to facilities. It also frees up space for our mobile teams not to be on the ground all the time, because one can actually be decanted onto the e-pharmacy, those that are stable on that treatment. So what it means is that they don't necessarily have to go to clog up facilities or implementation sites. So in that instance, it is well received because clients that are caught up at work, that live in back of beyond areas, they can still receive their medication without having to worry. So in that instance, we've seen a good uptake in terms of numbers.
Most importantly, is this a free service?
Definitely, it is a free service. Whoever is part and parcel of our program, they are offered medication as well as this particular service. Everything is free. What we are trying to do is to ensure that there is access to medication. Once there's access to medication, it results in positive health outcomes. That's basically what we're trying to do. So we want to get to 2030 and without new infections. So we are there to curb further spread of HIV, as well as ensuring that there is no more new infections. So that's where we are currently.
All right, Edward, thank you so much for your time and talking to us there about a very important initiative which they have embarked on. That is Edward Sibanda, Key Populations Technical Lead, talking to us there about this initiative, which of course allows one to get their medication delivered to them free of charge.